Hello, I'm Wanan Song at Seoul National University Hospital. We sincerely thank you, the World Journal of Mental Health, for the honor of introducing our paper.
The title is Changes in the Prevalence and Risk Factors of Erectile Dysfunction During a Decade. The Korean Internet Sexuality Survey, a 10-year internet web-based survey. ED has been an important cause of decreased quality of life in men. ED has been reported to be strongly associated with a quadruple of the prevalence of treated heart disease, a tripling of diabetes mellitus risk, and a doubling in chronic disease prevalence in smokers. Since the Massachusetts Men's Aging Study, a large epidemiological investigation discovered a high ED prevalence of 52% in the general population of men aged 40 to 70 years from 1987 to 1995, related to the studies have been conducted. Our research group also reported on the prevalence of risk factors of ED in Korean adult men based on the Internet Questionnaire Survey in 2006. Not only chronic disease, but also lifestyle change, social cultural and social psychological phenomena such as obesity, physical activity, marital status, and anxiety have been known to affect ED. Most studies on ED prevalence were one-time cross-sectional studies. However, since social change over time may have affected sexual behavior, prevalence, and the risk factors of ED, the longitudinal study was needed. We aim to elucidate the change in ED prevalence according to age groups associated with a social cultural transition and the alteration in the risk factors accompanying them, through a 10-year survey targeting the same previous group with the same methodology. By emailing 100,000 panel members extracted using the proportional quota sampling method, and finally selected 2,569 men who expressed interest in participating. The final number of subjects was 900, and the total response rate was 35%. 200 men were in their 20s to 50s each. For the 60s, only 100 participants were recruited owing to the small number of eligible Internet users. Inclusion criteria were that men in their 20s to 60s who had one or more sexual encounters per month in the last 6 months. Only those men who answered all questionnaire items were included in the research. Exclusion criteria were that subjects who answered the questionnaire too slowly and too quickly were excluded. The questionnaire was consisted of 111 questions: smoking, drinking, BMI, sexual history, and general health problem, IIEF-5, IPSS, IELT were evaluated. Self-ED was defined as a single question: do you have ED? And requested to yes or no. IIF-5 ED was defined as subjects with less than 21 of IIF-5 score. Primary endpoint was the change in the overall prevalence of IIF-5 ED in over a decade. The different characteristics, regardless of age group, between the 2006 and 2016 study groups was higher than that in the 2006 study. In 2016, the number of subjects in their 20s and 40s with a single marital status was higher than that in the same age group in 2006. In 2016, the number of subjects in their 20s and 30s with a large number of sexual partners and morning erections were higher than that in the same age group in 2006. The prevalence of ED in the 2016 study was found to increase with age. The overall prevalence of II-5-ED in 2016 was comparable to that in 2006. However, the prevalence of II-5-ED for the 20s age group in 2016 was lower than that in 2006, although there was no difference in the other age groups. Not only the overall prevalence of self-ED in 2016, but also the prevalence of self-ED in all age groups except for the 50s was lower than that in 2006. This shows the difference by age group at evaluation on the prevalence of ED according to age group after adjusting for the other variables. There was no difference in the prevalence of II-5-ED in subjects beyond their 30s between the 2006 and 2016 studies. However, there was a significant difference in II-5-ED in the 20s age group only. The ED risk factors for the 20s age group in the 2016 study were psychosocial risk factors such as depression and lack of conversation about sex with a sexual partner. For the 50s age group were lower monthly income, present smoking, and DM and self-PE. The mean total IPSS was increased according to ED severity. There was no statistically significant difference, although they were related to each other. Finally, over the past decade, the overall prevalence of age-adjusted SFED has declined, but the overall prevalence of II-5-ED was not different. Psychosocial approach needs to be considered in healthy young patients with ED. In older patients with ED, a focus on chronic disease is required. Thank you for your attention.